Stand up from your chair right now. Don't use your arms, just your legs. Can't do it? You're not alone. Your muscles are disappearing. 8% every decade after 60. That's not a metaphor. It's literal muscle tissue vanishing from your body. This is why opening jars feels impossible. Why standing up from chairs requires pushing with both arms. Why carrying groceries leaves you exhausted. Why you dropped that fork last week and couldn't pick it up without grabbing the table. You're not getting old. Your muscles are starving. But here's what nobody tells you. This is completely reversible in 30 days, not with gym memberships, not with complicated equipment, not with exercises that destroy your joints. 5 specific movements that physical therapists use with their weakest, oldest patients, because these movements work when nothing else does. James Wilson, 71 years old. 4 months ago, he couldn't stand from his couch without rocking back and forth 3 times and pushing hard with both arms. Sometimes he'd get stuck halfway up. His wife had to help him. He saw fear in her eyes. Started these 5 exercises. No gym, no equipment, just his living room. 4 weeks later, stood up from a chair 10 times in a row with 0 arm assistance. His legs, which he thought were gone forever, came back. His physical therapist called me in shock. I've never seen someone his age regain strength this fast. What did you do? I'm Dr. Akio Matsumoto. I've worked alongside physical therapists for over 40 years. What I'm showing you today is the exact protocol they use when someone is too weak for regular exercise, when someone has been told they're too frail, when doctors say, just take it easy, when family members start talking about assisted living. This is what physiotherapists do behind closed doors to reverse that weakness and bring people back from losing their independence. 5 movements, 0 equipment, done at home, 3 times per week, 15 minutes per session. Stay with me. 7 minutes. That's all you need to learn what could give you back your independence, your dignity. I have James on the line right now. He's going to tell you exactly how weak he was, the embarrassing details, the scary moments. Because if you recognize yourself in his story, you'll know these exercises are for you. Let me call him.
Dr. Matsumoto, hello.
James, tell everyone how weak you were 4 months ago. Be specific.
I'm James Wilson, 71. 4 months ago, I felt like my body was shutting down. Vulnerable, getting off my couch. I had to rock forward 3 times to build momentum. Then push hard with both arms. Face would turn red. Sometimes I'd get stuck halfway, legs shaking, and have to drop back. My wife started answering the phone for me. She just started doing it. Watching me struggle was too painful. Carrying groceries from car to kitchen 30 feet, I'd stop halfway and rest against the wall. My arms would shake holding 2 light bags. Milk and bread. Opening jars? Kept them sealed until my son visited Sundays. I was 71 waiting for my son to open jars like I was a child. Fear. But the moment that terrified me was at dinner one Tuesday. I dropped a fork. Bent down to pick it up. When I tried to stand, I couldn't. My legs wouldn't work. I grabbed the table edge and pulled myself up, knocking over a water glass. My wife jumped up to help. I saw something in her eyes I'd never seen. Fear. She was afraid of what was happening to me. That night, she said, James, we're calling Dr. Matsumoto tomorrow.
What did I tell you about traditional exercise?
You said, James, if you go to a gym and try squats or weights, you'll either get injured or burn out. Your body can't handle that yet. You explained when you're really weak, you can't jump into normal exercise. You need to rebuild foundational strength. You called them functional progressive movements. Exercises mimicking real-life activities but controlled, safe, gradual. 5 exercises. 3 times weekly. Monday, Wednesday, Friday. 10 to 15 minutes each session. You said, these are the same exercises we use with 85-year-old surgery patients. If they work for them, they'll work for you. Excited, faster, week 1. My legs felt more stable. Like they weren't going to buckle walking to the bathroom. Week 2. Standing from the couch got easier. I only needed to push with my arms a little. Week 3. I stood up from a dining chair without using my arms. For the first time in months, I yelled for my wife to come watch me do it again. She came running thinking something was wrong. I stood up and sat down 3 times in a row like a kid. She cried. We both cried.
And now, 4 months later,
Now, I stand up from sitting 10 times in a row. Easy, not even breathing hard. I carry all groceries in one trip. No stopping. No shaking. I opened a jar of marinara sauce last week, really stuck without asking help. And the big one, last Sunday I picked up my 3-year-old grandson. Lifted him over my head. Made him laugh. My physical therapist tested my leg strength last week. She said I've regained 60% of the muscle I'd lost. At 71, that's borderline miraculous. Direct to viewers, if you're listening and recognize yourself in my story, if you're struggling to get up from chairs, if your arms shake carrying light things, if you feel weak and it scares you, listen to Dr. Matsumoto. Learn these 5 exercises. Do them consistently. They saved my independence. They saved my dignity.
perfect, James. Thank you. What James experienced is sarcopenia, age-related muscle loss. After 60, most people lose muscle faster than they build it, but it's reversible. Here are the 5 exercises. Exercise 1, chair stand. What it does, rebuilds leg strength. For standing, walking, stairs. How to do it, sit in sturdy chair, feet flat, shoulder width. Key, lean forward so nose is over toes. Push through heels and stand. Lower with control. Level 1, use arms to push. 5 reps, 3 sets. Level 2, fingertips only. 8 reps, 3 sets. Level 3, arms crossed. 10 reps, 3 sets. Mistakes, standing straight without leaning. Rocking for momentum, going too fast. Do 3 times weekly, never consecutive days. Exercise 2, wall push with hold. What it does, rebuilds arm, shoulder, chest strength. How to do it, stand facing wall 2 feet away. Palms flat at shoulder height. Keep body straight, bend elbows, lean until nose almost touches. Hold 3 seconds, push back. 3 feet from wall. 5 reps, 2 sets. Level 2, 2 feet from wall. 8 reps, 3 sets. Level 3, 1 foot from wall. 12 reps, 3 sets. Mistakes, back arching, not holding, starting too close. Do 3 times weekly. Exercise 3, heel raise. What it does, strengthens calves, improves balance. How to do it, stand behind chair, hold lightly, rise onto toes high, hold 2 seconds, lower slowly. Progression, level 1, both hands, 10 reps, 2 sets. Level 2, fingertips only, 15 reps, 3 sets. Level 3, one hand, 20 reps, 3 sets. Mistakes, rising too fast, not going all the way up, holding breath. Do 3 times weekly. Exercise 4, seated knee extension. What it does, isolates quadriceps without stressing knees. How to do it, sit in chair, back against backrest. Slowly straighten right leg fully. Point toes up. Hold 5 seconds. Lower slowly. Complete all reps before switching legs. Progression. Level 1, no weight. 10 reps per leg. 2 sets. Level 2, light book on ankle. 12 reps per leg. 3 sets. Level 3, can of soup as weight. 15 reps per leg. 3 sets. Mistakes, swinging leg, not fully extending. Holding breath, do 3 times weekly. Exercise 5, wall sit. What it does, builds leg and core endurance. How to do it, stand with back against wall. Walk feet out 1 foot. Slide down until thighs parallel to floor. Keep back flat. Hold, breathe normally. Level 1, hold 10 seconds, 3 times. Level 2, hold 20 seconds, 3 times. Level 3, hold 30 seconds, 3 times. Mistakes, knees past toes, back not against wall, holding breath. Do 3 times weekly. Most challenging. 5 exercises, your complete protocol for reversing muscle weakness. Chair stands for getting up. Wall pushes for upper body. Heel raises for balance. Knee extensions for leg strength. Wall sits for endurance. Do all 5 3 times weekly. Monday, Wednesday, Friday. 15 minutes per session. Start at level 1 for every exercise. I don't care how strong you think you are. Start easy. Progress slowly. Rushing leads to injury or burnout. Most people see improvements in 3 to 4 weeks. Significant gains take 2 to 3 months. Be patient. What to do today? 1. Talk to your doctor. Show this exercise list. Get cleared for activity. 2. Start this week. Don't wait. Every week you delay is another week of muscle loss. 3. Track your progress. Write down reps and levels. Seeing progress is powerfully motivating. 4. Be consistent. 3 times weekly. No excuses. Consistency beats intensity. If this gave you a clear path to rebuild strength, subscribe right now. Every week I share protocols like this. Real solutions for real problems. Hit subscribe. Turn on notifications. Share this with someone struggling with weakness. Comment below. Which exercise will you start with? What's your biggest struggle? Chairs? Carrying things? Opening jars? Muscle weakness after 60 is not inevitable. You have more control than you realize. These 5 exercises work. They worked for James. They've worked for hundreds of my patients. Will they work for you? That depends on whether you actually start. Don't accept weakness as your future. Fight back. Do the work. I'm Dr. Matsumoto. Get stronger. See you next time.